Yeah, hello. I'm David Scott, orthopedic surgeon, focusing my practice on hip and knee replacement. I'm happily married with a 120-year-old son in film school in LA. I love the outdoors, hiking, backpacking, downhill skiing, fly fishing. Fly fishing in particular is a joy. We've gotten into saltwater fly fishing, which is a blast. The fish are bigger and meaner and fight harder, basically. You're potentially going after these monsters that it's super exhilarating. In terms of my education, I went to college at Cornell University in Ithaca, New York, and then I did my medical school training in Boston at Tufts University. And then I went on to do my orthopedic residency at the Hospital for Joint Diseases in Manhattan in New York City, and then finished my training with the final fellowship year in Salt Lake City at the University of Utah with Dr. Aaron Hoffman. I think I always thought I was going to gravitate towards medicine, but honestly, I had other interests too, and I wasn't sure. And so I needed to get some exposure. And so that's how I did it. That summer, clerkship, shadowing the general surgeon, very valuable. One of the other important moments that helped lead me to this point was a 1-month internship I did during the fourth year of medical school, where I spent a month at the Hospital for Special Surgery in New York City, which is honestly like one of the world's preeminent orthopedic centers. And I spent a month with several of their total joint surgeons there. And in particular, to this day, I remember scrubbing in with a Dr. Ranawat, who was like one of the gods of the field at the time, and watched him perform a hip replacement surgery literally in like 30 minutes, but just to make it look so perfect, so elegant, just so clean. And from then on, aspired to being able to be a surgeon like that. There's absolutely an art. I mean, to make a difficult, complex surgery look so clean and smooth and not rushed at all, and yet for it not to take very long, I aspire towards that. I'd be amiss if I didn't mention my last full year of training, my fellowship year with Aaron Hoffman in Salt Lake City. I spent a year with him, Dr. Hoffman, focusing purely on hip and knee replacement. And, honestly, I trained with a number of great surgeons in New York, but in some ways, Dr. Hoffman was next level. He was like a Dr. Ranawat, where he was such a good surgical technician, where again, he'd make these difficult, complex, risky in some cases surgeries just look so smooth and clean and slick. And so that year was the icing on the cake, the finishing touch, or whatever one might say, that I think helped form who I am. What led me to picking hip and knee replacement is that I'm a very mechanically oriented guy, tinkering, tearing things apart, rebuilding engines, finished carpentry, building furniture. I love working with my hands. I love building things. And in the field of medicine, orthopedics is exactly that, and especially hip and knee replacement is exactly that. We're fixing things, taking them apart and putting them back together in a figurative and literal sense. And so, in all honesty, with hip and knee replacement, it's very definitive the vast majority of the time, in the sense that we take a patient with a broken hip or broken knee, broken in the sense of, not working well, arthritic, painful, stiff, not functioning properly, and we truly fix that. We fix that problem. It's not like, not to denigrate the general doctors in the world, but it's not like, just writing a prescription for a medication and maybe the patient gets a little bit better or whatever. This thing is fixed, done, very definitive, and it appeals to me greatly.